Hello, my name is Megan Marsh, and today I will be presenting what is unique about the UK healthcare system, discussing the changing environment and how it interacts with pharmaceuticals. For some people, COVID-19 would be the reason to look further into the unique qualities of our UK healthcare system, the NHS. However, for me, this isn't the case. My mum works within the NHS, and so from a young age, I've been able to understand the importance of the NHS within the community and several unique benefits that our healthcare offers opposed to other countries such as America. The first thought that springs to mind when I think about what is unique within the NHS would be its value for money. The NHS was rated better value for money than healthcare systems such as the US, France, and Germany. One example that showcases the value for money the NHS provides is by looking into a common procedure such as an appendectomy. In the US, this procedure costs between £10,000 and £35,000 for patients who are not covered with healthcare insurance, compared to a £12 prescription charge for follow-up medication after the procedure in the UK. Secondly, the NHS is adaptable. Since 1948, the NHS has shown that it can adapt to changes in the medical field. Research and development to produce new medicines and medical technology is very costly. In other healthcare systems, access to these would be dependent on your insurance cover, which would in turn be dependent on how much you and your employer are willing to pay into an insurance plan. In contrast, under the NHS, it is possible for everyone to have access to the latest technologies regardless of your financial status. Thirdly, the NHS is a network and work cooperatively, enabling the organisations to share good ideas, staff, expertise and new technology. One example of a public health policy that the NHS introduced was the Stroke Act Fast campaign, in addition to the introduction of screening for cervical, breast and bowel cancer. The organisation of the NHS means that there is great potential for exerting control over prescribing, which has been invaluable at keeping down the total costs of medicine within the UK. Without a doubt, the NHS is one of the fairest healthcare systems in the world, as by sharing the costs via taxation, high-quality healthcare can be administered to everyone according to their need, meaning that payment issues or difficulties is not a factor when deciding your healthcare plan. All of these qualities were further highlighted in a BBC News article that ranked the UK's healthcare system as number 1 in comparison to 11 other countries. The NHS's success can also be displayed through this 70-year timeline, where they have created key milestones in the pharmaceutical industry, from introducing prescription charges in 1952 to enabling transplants in 2010 through scientific research and technological developments. This timeline brings me on to the future of the NHS in our ever-changing environment and its relations to pharmaceuticals for companies. Previously, the NHS has been asked to deliver better results with less resources, whilst continuously innovating at the same time. This caused pressure for both the NHS staff and scientists undertaking research. Therefore, the NHS introduced a long-term plan in 2020 to help tackle current issues which will inevitably have an impact on pharmaceuticals in both development and distribution. A new service model. This new service model will provide patients with better support, more options and properly joined up care through innovations such as online digital GP consultations and social prescribing. This will enable GPs and other frontline healthcare professionals to refer patients to a link worker, enabling them to receive face-to-face care and conversations where they will learn about the possibilities and designing their own personalised solution. This will relieve pressure from pharmaceutical companies, as customers will have a greater understanding of the impact of the drugs they have been prescribed. Preventing illness will require funds in prevention programs such as cutting smoking and reducing obesity. This will be important for a pharmaceutical company because if these campaigns are successful, there will be less research and development into medicines to help obesity and cure cancer caused by smoking. This free time can then be spent developing medicines to help genetic conditions such as respiratory diseases. The NHS also have a 5-year forward view, which focuses on cancer, mental health, diabetes, and healthy aging, including dementia. This will benefit a pharmaceutical company such as BI because they will receive more funding into their key scientific focus areas. However, distribution of these drugs may require more monitoring from the NHS as mental health varies from person to person, and in order to get effective care, each patient needs to be fully assessed before being diagnosed and prescribed. Also, in the long-term plan, the need for more support and staff was highlighted several times. I think this will be successfully carried out after coronavirus has aided the country into understanding the importance of both the NHS and scientific research. Support in the form of finance will positively impact pharmaceutical companies as it will enable them to carry out more research and development. Over the next 10 years, the NHS are aiming to provide digital access to services widespread, enabling patients and their carers to better manage their health and health conditions. This could result in a shift in pharmaceuticals distributing from business to business to consumer, if consumers are able to buy their prescriptions directly from pharmaceutical companies through a widespread record of data showcasing the patient's healthcare plan. This could inevitably cause confusion for pharmaceutical companies if they have to increase their distribution channels. I believe this long-term plan will have more support than in previous years from the government and community as coronavirus has showcased the importance of the NHS. Furthermore, the constant development of technology will help the NHS reach its core goals while maintaining its competitive edge over countries such as the US and France. By discussing the NHS's unique long-term plan, we are aware that our environment around us is constantly changing and developing with the help of technology. Therefore, it's down to the pharmaceutical companies to innovate quickly in order to enable the changes to go ahead within the pharmaceutical industry. As we've seen during COVID-19, pharmaceutical companies have had the ability to change direction quickly to help the current crisis by spending a lot of time looking for a vaccination to help solve the coronavirus. I believe pharmaceutical industry is going to continue to change in terms of both distributing and development areas. In terms of development, pharmaceuticals, new technologies such as big data and AI are revolutionizing the pharmaceutical industry. New technologies that are likely to distribute include 3D printing, which can be used to customize everything from drugs to prosthetics, and artificial intelligence, both of which are changing the way new drugs are developed as we speak. Additionally, the current funding to R&D is broken down into the following sections. However, in the future, if campaigns such as quit smoking and obesity prevention are successful, the budget showcased here may shift as less money may be required in certain fields. In terms of distribution, the UK healthcare system is unique because unlike in America, the UK is unable to bump up its retail prices for medicine. This is due to the NICE guidelines. National Institute for Health and Care Excellence role is to improve outcomes for people using the NHS and other public health and social care services. The aim of NICE guidelines is to develop quality standards and performance metrics for those providing and commissioning health, public health and social care services. These guidelines have a direct impact on how pharmaceutical companies sell their product as they have to conform to the following rules and regulations. This is a list of my references that helped me to conduct my research and put together this PowerPoint. I really hope you've enjoyed my presentation, and I would be more than happy to answer up any follow-up questions. Thank you. Bye.